If you're listening to this podcast or if you're watching me on YouTube, you've been on this journey for a few minutes now, and it's because you don't feel good. And if you've been on this journey, you know that there is so much out there. And how do you know where to start? Do you get blood work? Do you go mold testing, hormone testing? Just make it make sense. So today's episode, I'm going to help you walk through this maze. I'm not selling you anything or telling you what supplements to take. I'm just giving you a map. And I wrote a book about it. It's right here. And even though the book is pretty short, today is the cliff notes to what is already a short book because I don't really like to read either, so I get it. So let's start on how to get started. And for those of you who are watching, I always want to let you know how to reach me and my team. So if you're watching me on Facebook and now you can hear me, drop the word live and let us know that you're here. If you're watching us later on, drop the word replay. Anywhere you are, if you drop the word change, it lets us know you want the show notes and we'll email those to you. If you're on YouTube, don't forget to like and subscribe because it's nice and it doesn't cost you anything. So just do it. Don't be mean. Don't be stingy with your likes and your follows. If you're on the podcast, of course, I'm wearing the stethoscope my wife gave me, and my hair is always looking fabulous, and I'm wearing gray. Wherever you are, follow us on Instagram because we're funny. And share this with the people that you love. So some of you listening are already game changers. And people might be asking, what's this all about? How do you start? Where do you go? This would be the episode to share with them so they know how to start, whether it's with us or somewhere else. And if you don't know who I am, my name is Efrat Lamandre and everyone calls me E. And I invented the new method where we empower people to realize that their symptoms are not in their head because you always knew there was a better way. So join the conversation wherever you are. And let's start. Let's start. So the reason I decided to do this episode, I've been doing this now for over a year, is because so many people don't know where to start. And I don't blame them. It's so overwhelming. If you're here listening, you're one of 4 categories. Okay. And you can let me know where you are, which category you're in, wherever you're listening. The first one is the I don't feel good itis category. This is you're tired, you find yourself dragging, maybe you're not sleeping well. Things are just not as they used to be. And you go to the doc and they say, your labs are fine. You're fine. See you next year. This is just a normal part of aging. What do you expect? That's the first group. Second group is maybe you're given a diagnosis or 2, diabetes, hypertension. You take medications and your medical provider says, see you in a few months to monitor and refill. End of conversation. You're fine. Group number 3, maybe you have a little bit more of a complicated diagnosis. So maybe you have an autoimmune issue and you have flare-ups and you have multiple specialists and each one manages a different body part. One guy does GI, the other one manages your joints. And no one ever offers the conversation that says, hey, by the way, all these body parts are connected. Like maybe your gut and your joints actually have the same underlying issue. Nah, you're fine. I'll see you in a few months. And then group number 4 are the if it ain't broke, don't fix it crowd. So you're not one of the above, you don't have any issues, but you feel great, but you're worried and you're thinking about how to optimize your health because you don't want for it to break before you fix it. You want to be, preventive. You want to be ahead of it. So if you're one of these 4 categories, you're in the right place. First of all, no matter which category you're in, you're not fine. None of this is fine. It's just not fine not to feel well. It's not fine not to know why you're taking medication or what's going on. It's not fine not to have a plan of action. It's not fine to have 12 different specialists in each body part like things aren't connected. And it's not fine not to have a prevention plan for things that are okay right now. It is not fine, no matter where you are on the spectrum. And before I go on, I do need to say this. All 4 groups that I just mentioned, all of them have been to some sort of medical provider, doctor, NP, PA, and they were evaluated. Some have gotten no answers, some have gotten partial answers, but this is important. This episode is not for you if you've never been to a medical provider. If you're not feeling well and never had any blood work or imaging or a visit with a medical provider, shut this episode off, go make an appointment. You must start there. Don't diagnose yourself. Don't diagnose yourself based on this episode or anything you hear on the interweb. Okay, the patients that come to me have already had millions of tests, images, appointments. They come to me when they don't know what to do next. And I'm not saying I'm smarter than any of your current medical providers. They're all amazing. They're super smart. They're super caring people. What I have is a skill set to see how things are connected. I have a gift of being able to take all the information that you've gathered along the years and make it make sense. I connect the dots. I help create a plan. Now, when you work with me, it's all customized to what's going on in your life, but there is a basic framework that I use as a guide. And today I'm sharing that framework with you so that you know how to start. Now, for those of you who don't know me, I don't know how you don't know me by now when you're still here, but I need you to know a little quick story of how I got into all of this, because once you understand my story is your story, and then you'll see how I come up with this framework. You need to understand that I went to school, I became an FNP, I opened up my own practice called EG Healthcare, and I was living the dream. I have a great primary care practice. We see over 20,000 patients. My days are full. The practice was thriving. Everything is fine. And I could have just kept going with that. But instead, I went back to school and started all over again. I had to learn so many new things. And honestly, learning those things, a lot of times I had to face some ridicule by some of my colleagues who think this whole thing is quackery. Why did I do it? Why do any of the people in functional medicine, why do any of us go into this? Why are we crazy enough to go back to school? Why do any of you listening to this go down this rabbit hole? I'm sure so many of you actually wish you didn't know what you already know right now. And the answer is because the system failed us. We are all here right now because we either got sick or someone in our life got sick, and conventional medicine was just not enough for us. Now, when I say this, I always want to say I'm not against conventional medicine. I love it. I practice it. But now I recognize its limits. My wife was diagnosed with 2 autoimmune issues, and she had to give up her career because she was so debilitated. And all that was offered to us was heavy duty medications. And we just knew there had to be something else. By the way, that's why it's called the new method, because we always knew there was something else. So we started digging. And you have to remember, I'm a little older, so the internet is not what it was, what it is right now. So digging was a little bit harder. And someone told us about this crazy thing called functional medicine. So we decided to try it. And we did. And guess what? It worked. It actually worked. And my wife's life was transformed. Her autoimmune calmed down. We got our lives back. And I knew I had to bring it back to more people, just like you guys listening here. But I didn't know where to start, just like you don't know where to start. So I started taking classes and more information, and kept learning and learning. Eventually, I got my PhD in integrative medicine. And I created a new method. I created this system, this framework that I use with my patients. And though each patient is different and needs different things, the framework is the same. And that's what I'm going to show to you. So where do we start? In case I wasn't clear, you must start with your PCP first. Make sure you go to every specialist they recommend. And you might say, that doesn't make sense. You just told me conventional medicine failed you. Why would I start in conventional medicine? Because you have to use all of the tools, not just one tool. Just like conventional medicine has its limits, functional medicine has its limits. And you need everything, all the tools. It's critical that you get some basic labs, some images, so that we know what we're dealing with and what we're not dealing with. Like, let me give you an example. If you're tired, you might say, I read online that my symptoms really match adrenal fatigue. I just need some supplements for adrenal fatigue. But if you don't do the blood work, how do you know you're not dealing with anemia or cancer? So you have to get the basic labs before you even consider going down the functional medicine road. So you start there. You start with your PCP. If you have a diagnosis, great. We have somewhere to start. And if there's no diagnosis after seeing 27 providers, don't get frustrated. It's still great. It just doesn't mean it just means you don't have a diagnosis yet. So if you're feeling crummy and no one in conventional medicine can find out why, this is actually a blessing. Don't get frustrated. You just use one tool, and now it's time to go on to the next tool. And for those of you who have a diagnosis, same thing applies to you. You just heard one perspective and on your diagnosis now, and now it's time to get another perspective on your diagnosis. Okay, so that was step 1. See your medical provider, your PCP, your PA, your MD. So at step 1, I got my list of diagnosis, or I was told nothing's wrong with me. What's step 2? How do I start feeling better? And the answer is you have to focus on the root cause. And the root cause of all health issues is inflammation. And the root cause of all your issues is inflammation. Chronic inflammation over time will trigger everything on the spectrum from I don't feel good all the way to chronic disease. If you want to feel better, if you want to manage your health issues, you have to manage your inflammation. Side note, not all inflammation is bad, right? We need inflammation to stay alive. If we get hurt, the area gets inflamed, and we need that area to get inflamed temporarily as we heal. That's normal. That's short-term inflammation. We need that. We can't live without it. What I'm talking about is chronic daily inflammation that drives disease. Because inflammation affects everything: your brain, your stomach, your skin, your joints, your immune system, everything. Okay, so the root cause of inflammation, you still didn't tell me, but what's causing it? Is it mold? Is it Lyme? Is it adrenal fatigue? Is it my hormones? The answer is, I don't know. It could be one, it could be all of them. But the point is not to jump to one test. It could be all of them, it could be none of them. The journey is about having a system slowly and methodically ruling each one of these in or out. But you have to start. Everyone must start in one place. You have to start with your gut. Now, I'm not saying that everything will go away for every person once we heal the gut, but I am saying that there's no point in looking on any other test or doing anything further until your gut is on point. You can't remove inflammation from your body if you're eating inflammatory foods all day. Like, what's the point of getting mold testing if you're still eating the standard American diet? It makes no sense. Even if you have another source of inflammation, maybe you do have mold, maybe you do have Lyme, maybe it is your hormones, but you won't even be able to handle the treatment until your belly is on point. Because the treatment for mold, for Lyme, guess what? It's really, really hard on your belly. And if your belly is still inflamed, you won't be able to handle it. So no matter what, you have to start there. Now, this is where I lose some people. I have to be honest, because people want a fancy test. They want a fancy test. They want one answer. They want one supplement that fixes everything. It doesn't work this way. There are no quick fixes. And anyone who sells you a quick fix, 30-day protocol, the reset, they're not being truthful. I don't want to say they're lying. That's not nice. They're not being truthful. If you're not feeling well, there's probably several reasons, and you have to peel away at it layer by layer, but you must start at your gut. The gut is the main source of inflammation. It's in charge of your mental health, your autoimmunity, your hormones, your neurotransmitters. There is everything. It's in charge of everything. If it's not on point, absolutely nothing else in your body will be on point. Now, some of you might say, okay, yeah, this makes sense. My stomach is bloated all the time. I always have stomach issues. I never feel right. I'm always constipated. I always have diarrhea. It makes sense that you're telling me this because my stomach's a mess. But some of you who are listening might say, I really don't have any gut issues. Everyone keeps talking about the gut. I have a skin issue, a joint issue. I have brain fog, but my stomach is fine. So I'm here to tell you, you still have a gut issue, even if you don't have GI issues. Remember that story I told you about my wife and her autoimmunity? Her stomach was fine. She never has belly issues, but her nutrition, her gut was still causing her autoimmunity. But this is something called leaky gut, and I did a whole episode about it. Go ahead and find it. But it doesn't even matter if you don't have GI symptoms. You still have to start there. So if you're listening and you have the bloating, obviously start there. And if you're listening and you feel like your GI is fine, you still have to start there. This is where you start. You start with your nutrition. If you skip this part, everything will fall apart. If you skip it and say, nah, I know I have mold, and you do a mold test, and it's true, you have a mold test, your treatment will not work if your belly's still a mess. Same for Lyme, same for hormones, everything. So the next question is, all right, what do I do after I fix my gut? I got it. You tell me, what do I do? Okay, so here's the thing. Sorry, I have something in my mouth. Here's the thing. For many of you, your symptoms will disappear once you get your nutrition right. They'll just go away. And I'll explain to you what right nutrition means in a moment. It'll just go away. So guess what? If you fix your plate and you feel great, you're done. No further testing, no further questions. You're done. And some of you will feel better and overall, but you'll still have some symptoms in certain areas. This is when you start doing the testing. And remember, now because your gut's on point and your liver knows how to detox, now you can actually do something with these results if you have any positive results. So before I tell you which test to do next, let me tell you what I mean by getting your gut right. Okay, there's a 4R protocol. I didn't invent it, it just exists. The first one is called remove. You have to remove all the junk and anything else that hurts your belly and causes inflammation. It's got to go. Got to get rid of the high fructose corn sugar, the gluten, the dairy, the corn, the soy. Some people might need to eliminate more legumes, eggs, nuts. While I don't know exactly what you need to remove, at the very least, start with gluten, dairy, corn, soy, and sugar. Just start there. Just start there. So that's remove. Second R, replace. You got the bad stuff out. You have to put the good stuff in. So many of you are great about removing stuff, but you forget to put in the good stuff. You have to look at your plate and say, do I have enough green leafy vegetables? Is there color on my plate? And you might also want to consider putting in some digestive enzyme supplements. Third R, re-inoculate. This is when we add probiotics. Don't add probiotics in the beginning because for many people, they're like, oh, my stomach hurts. I don't feel good. Let me grab a probiotic. That actually makes it worse if you put it in too soon. So this is why it's the third step. Once things are calmer, that's when you put it in. And then you have the repair. Repair is, so we calmed it down. Things are better. The war has calmed down. This is a good time to start repairing. And the way we repair it is we put in some good stuff. We could put in collagen, amino acids, vitamin A, bone broth. That's the four R's. And you'll notice immediately they feel better. Now, that being said, every once in a while, I have some people who feel worse the first week or two. And that's because coming off the standard American diet is like detoxing from a drug. So don't get scared. If the first week is hard, push through it to the other side. You'll be glad you did. There is a fifth R, which is reintroduction, because at some point you will want to bring back some of the food items let go. And you're going to do that slowly and listen to your body. Okay, got it. My belly's good, but I still want to know about the fancy tests. I still want to know, do I have mold? Do I have Lyme? What do I do? So your next step, right? We went to PCP, you fixed your belly. Your next step is to choose a test depending on what symptoms you have left. For example, if you're really exhausted, especially fatigued after workout, your next test is going to be for adrenal fatigue. I did a whole episode on it. Find it on the playlist. It's a saliva test. The company we like to use is called Doctor's Data. I'm not affiliated with them, but they're awesome. Number 2, food sensitivity testing. If your belly or your skin is still off after you've done all this work, that's a good time to consider food sensitivity testing. We like a lab called Cyrex. If your stomach is still a mess, despite all the work that you did, it's a good time to consider stool testing. We like Genova for their GI map. And if you're feeling tired, but you also have some weird symptoms like brain zaps, internal tremors, or severe sensitivity to chemicals or smells that does not resolve, this is a time to consider mold testing. And if you still have joint pain or joint swelling with extreme fatigue after you did this work, you might want to consider Lyme or other tick-borne disease. And we like IGeneX for that. Hormone testing, sure, hormone testing is a thing. For most people who are younger than menopause age, most of the time, once you fix your nutrition, your hormones do tend to get balanced. But for the postmenopausal woman, hormones are truly a reality, and you might need some hormones, and the hormone testing is appropriate here. But again, I won't even consider it until you fix your belly first, and we use doctor's data for that as well. The next big question is, what supplements should I take? And the answer is, I don't know. I don't know because it's really, really personalized and customized. That being said, you should at the very least be on a really good quality multivitamin, omega-3 because it's omega-3, you need to be on it, vitamin D, and some form of glutathione, either trisomal glutathione or NAC, which becomes glutathione. Because there are so many supplements and you have to decide, well, what are we working on? Some supplements are for adrenal fatigue, some supplements are for Lyme, but these 4 basics are a really good place to start. Okay, so let's do a quick recap. Of course, I did not click on any of the things here. Look, I put the supplements here. You know me, I always forget these to click on these things. But let's do a recap. So, if you don't know where to start, always start with your PCP. Go to all the specialists that they give you. Then make sure you do the labs, make sure you do the images. Maybe you'll get a diagnosis, maybe you won't. Doesn't matter. The next thing you're gonna do is fix your belly, get your nutrition right. Then see what symptoms you have left. And based on whatever symptoms you have left, you determine what test to do next, if at all. You may not need it. And of course, this is a lot. If you want to work with me and my team, I'll tell you how to reach us. But you can also do it on your own, or read my book, or go on my YouTube and watch all the episodes. Whatever works for you works for me. This is how you reach me and my team at the New Method. New is spelled with a K because you always knew there's a better way. And we are everywhere except for Twitter because I talk too much. We're everywhere. You know, the website, Instagram, podcast, YouTube, you name it, we're there. I hope this, whether you try to work with us or someone else, I hope this helps. I'll talk to you guys soon. And don't forget, you always knew there was a better way. I'll see you guys next week.